Everybody. We know we have some questions lingering about our new pre-registration system, so we wanted to go through it today just to have some clarity. And first and foremost, I just want to let folks know this is a pre-registration system only, so it saves your spot in line, and the system will notify you when an appointment becomes available. So anyone who lives or works in St. Clair County can register. But only those who fall in the current priority groups will be notified for a vaccine currently, okay? So please do not call to ask where you are in line. We're experiencing extremely high call volumes at the moment. And this link, we have it right here, this link, pre-registration for COVID-19 vaccine, that'll be on our website for the foreseeable future. So you can register day or night. And I know we've had some reported issues with the system. We're working on that. So thanks for your patience as we work through those issues. All right, so let's begin. Let's start. Pre-registration for COVID-19 vaccine. This link is on our website, scchealth.co. So we're just going to click on that. And we're going to go through a pre-registration together. So we're going to hit sign up right here. I'm going to ask some basic information. You're going to have to create a username and a password. So if you look on the side, it'll tell you what exactly needs to be in that username and password. For the username, you need a minimum of 4 acceptable characters. And for the password, you need at least 8. And it tells you what's acceptable and what's not. So I'm going to plug in my username. And we'll plug in a password as well. Security question. There's a drop down. You can choose from multiple. Location information. So location name, if you are a resident of St. Clair County and looking for a vaccine, you're just going to keep it home and you're going to plug in your home address. If you work in St. Clair County, you're going to type in work and type in your work address, okay? So either way, it should be a St. Clair County address being inputted into the system. So I'm gonna, for our purposes, plug in our health department address. State will be Michigan. Postal code for Port Huron is 48060. And then the country is auto filled in. At this point, you're going to hit verify this address. All right, it looks like our address is correct. You're going to click on this is my location. Now the bottom portion. So this is the contact information portion, and this is how the system will contact you when an appointment is available to you. So it's important that you plug in as many of these as you can. So if you do have an email, SMS is for text message, and then primary mobile or landline is just the phone number. So we encourage you to plug in as many fields as possible in this category. So again, for our purposes, we're just going to put in a phone number. I accept the terms of use, create account. All right, so now we see that some of our basic information that we plugged in on that last page is appearing, and it's going to ask for something, some more additional information. So middle initial, suffix, registration email, and time zone. So there's a lot of options here. We're going to go down to Eastern Standard Time, and we're going to hit America, New York. Again, the contact information, it's going to ask again if you want to plug in that mobile phone number or landline, email, secondary email, etc. So we want to make sure that you're contacted right away and that you get our messages right away. So please, as many fields as is applicable, fill in. Save and continue. Again, it looks like our location address is correct, so we're going to hit save and continue again. So here's some more demographic information. Are you over 65? We'll say yes. Date of birth. Now, this system is particular about how you plug in this date of birth information. So you're going to do year, month, and day. So we'll say that we're born May 23rd, 1955. So we're going to do 1955, May, so 05, and 23. Okay? Now your birth date's plugged in. Sex. It's going to ask about race. So for this ethnicity question, we're going to want you to type in either Hispanic or non-Hispanic. So I'm going to do that right now. And so some people, depending on what browser they're using, they might see a number drop down. Just select any number, and that's a required field, so we need that filled in. Thank you for your patience as we're working through some of these bugs. If you are a healthcare worker, a long-term care facility worker, or an essential worker, please select those groups in these fields. Now here's the portion about pre-existing conditions. Please select whatever medical conditions you have. Insurance type. So this insurance information is optional. There will be no out-of-pocket costs, but in the future, there could be administration fees that are collected from your insurance company. Again, there'll be no out-of-pocket costs for you. And if you have any of that card information, this would be the spot to put that in. Save and continue. All right. So now we review our profile. It looks like everything is correct for what we want. So we're going to hit finish. All right. So there is no end screen, but the way you know that your information's has been submitted successfully is when in this left-hand corner, you see welcome and then your username. So you know that everything's been finalized and submitted and you are in the queue, you are in line to get the vaccine. Again, we just ask you don't call the health department at this time to ask where you are in line. We are experiencing high volumes of calls. All right, you can log out at this time. I just want to let everybody know when an appointment does become available to you, the system will send out a message with all of your preferred communication methods, whether that be email, text, phone call, or all the above. And you have an hour to respond. So if you don't respond within that hour, you're going to be put back in the queue and you won't lose your space, okay? So I know we have a lot of questions about that. You're just going to be put back in the queue and you won't lose your place in line if you don't respond within that 1 hour. So thank you, everybody, and have a great day.